Welcome to another edition of This is Public Health, a podcast presented by the Illinois Department of Public Health. Each new edition focuses on an area of public health and programs and services and policies that affect you. This week's edition is entitled Moving Forward, Battling Disparities and Inequities in Public Health. Returning to join us this week is the Director of IDPH, Dr. Sameer Vohra. We're also honored to be joined by a distinguished guest, Dr. Georges Benjamin, the Executive Director of the American Public Health Association, and thank you both so much for being here. Director Vohra, let's start with you. This is something we have talked about before, but I'd like to go a little bit further into what prompted your interest in this issue of health disparities, and how do organizations like APHA fit into the efforts of IDPH to address these disparities?
Well, Jim, it continues to be my pleasure to be on our podcast, and this time joined by one of the preeminent leaders in public health, Dr. Benjamin. Part of, I think, many of our journeys in public health have really sort of been foundationally set around our goals of social justice, right? When we think about the history of public health, it has been trying to advocate for policy and societal level solutions that helped those that were most vulnerable, right? At the core of that challenge around how do we create systemic solutions, understanding that certain individuals in our society, because of social and structural issues, just didn't have the same chance to be healthy as others. And from my career and from its beginning, from the days of my education of being a general pediatrician, but also wanting to combine that with law and public policy, was trying to take these issues around social justice and affect them through health. And we have seen that and continue to see that during the COVID-19 public health emergency now in so many of our disease states, is that we have great disparities in our country around being healthy and needing to move forward both as a state public health department, but with local health departments and with national leaders like the American Public Health Association to shape a vision and journey. And I think we are privileged to partner with national organizations like the American Public Health Association to set that trajectory, have so many of our employees be APHA members, and then also combine that with the overarching goals that we have as a country as we promote the public health of all.
Again, our guest today is Dr. Georges Benjamin, Executive Director of the American Public Health Association. Dr. Benjamin, again, welcome. Tell us a bit about your background and about the work you do on this issue with APHA.
Well, thank you very, very much. I am an internist and an emergency physician who got involved in public health in the early 1990s. I've been here at the American Public Health Association since December of 2002. So I've been here almost 22 years. And of course, one of the core beliefs of public health in general is health equity. And that has certainly been a benchmark of the American Public Health Association since its founding in 1872.
I'd like you each to weigh in on this question about these disparities. These have, of course, been an unfortunate reality for generations, but is this situation because of discrimination? Is it a reflection of harsh economic realities? Is it some combination of both of those and perhaps other factors as well? Dr. Benjamin, if you could start, please.
Sure. I like to think about these inequities as coming into four broad categories. First of all, differences in access to care. That's beyond health insurance. Health insurance is certainly one piece of this, but also differences in the ability to actually receive care. Differences in the quality of care received within the health setting, whether it's health care or the non-healthcare setting, but in things that impact your health. Differences in individual health-seeking behavior, often driven by life experiences that either encourage you to get healthy or discourage you to be healthy. And some cultural beliefs as well, sometimes getting into that. And then a whole big bucket of things like the social determinants of health. Now, racism and discrimination also fit within that bucket, where there are both conscious and unconscious biases that people have. There's obviously the hatefulness of racial discrimination. That's also a part about this. But those four buckets, when you put together, result in differences in health outcomes for people in our country.
Director Vohra, we have seen those four buckets here in Illinois as well. From your experience, do any of them outweigh the others, or are they all part of this big picture issue of health disparities?
Thanks to Dr. Benjamin for so well outlining those buckets. Part of it is that I think we have to embrace that all of them exist and all of them have to be part of the solution in ultimately addressing health disparities and aiming to get us closer to that goal of health equity. But understanding that each of them have different levers to pull, different strategies in which we need to go. And I think what one of the biggest goals for us as we recover in Illinois around the COVID-19 pandemic is that, yes, putting that out there, that those buckets are challenges, but also beginning the steps of operationalizing what those solutions are. And being both honest enough and brave enough to say that this is hard work and that we have to try many different strategies to ultimately get to a solution. That's going to take time. That's going to take advocacy. That's going to take resources. And thrilled to be in a position here in Illinois with Governor J.B. Pritzker's leadership, trying to drive to those goals and understanding that in order to get them through health, yes, it's a public health cause, but it's a cause throughout government and partnership with our residents and other private industries to reach that destination.
Here in Illinois, through our recent state health improvement plan, we've declared racism as a public health crisis. I'd like each of you to talk about the significance of that recognition. Director Vohra?
Well, we were thrilled to join many other leaders, including the American Public Health Association, to declare racism as a public health crisis, understanding that in our state health improvement plan and in our goal to be a healthy Illinois 2028 and march towards that way, the only way we could get to really understanding that in our processes and our solutions was owning it and claiming it as a problem. Now the real work begins because the State Health Improvement Plan, as many of our listeners know, was sent to the General Assembly at the end of 2023. And we are beginning in earnest right now to find the partners, to think about the different ways in which racism affects health, and then work through our partners in local health departments, in hospital settings, with community-based organizations to build up the innovative practices and determine how we can scale those with the right resources for action.
Dr. Benjamin, your thoughts on that declaration of racism as a public health crisis and the steps we can take to overcome that?
You can't solve a problem until you've identified it. So naming racism as one component of addressing these inequities is absolutely essential because it allows you to focus on that, those unconscious biases, those conscious biases, and the hatefulness of racism as a fundamental core issue that you can address. And then once you've done that, and people get their heads out of the sand because nobody wants to be considered as a racist, but once they begin to look at these structural systems we put in place that discriminate against people, that in many cases were put in place to keep people of color in their place, then you begin to solve the problem. Because in many ways, it's the structural situations that we put in place, redlining, housing discrimination, differentiation in access to capital, not allowing people to get quality education by exclusion. Those kinds of things are the things that ultimately result differences in health outcomes in communities and differences in prosperity of individuals and whole populations.
You're listening to This is Public Health with the Illinois Department of Public Health. Our guest this week, Dr. Georges Benjamin, Executive Director of the American Public Health Association, joining IDPH Director Dr. Sameer Vohra. Dr. Benjamin, could you talk about some of the ideas and initiatives that we've seen through the American Public Health Association or that you've seen coming out of Illinois and other states to address all of these issues, that what you refer to as these buckets that lead to the disparities that we see in access to care?
Well, the access to care care, the most important thing was, of course, expansion of under the Affordable Care Act to make sure that we aggressively address the number of uninsured we have in our country. We still have a ways to go. Interestingly enough, those states that have expanded their Medicaid program are doing much better from a quality perspective and outcome perspective than those states that didn't. Illinois, fortunately, is one of the states that did, and it benefits everyone, upstate and downstate. As you know, I grew up in Chicago, went to medical school in Chicago, and so I certainly understand the state very, very well. And access to care makes a big difference in both our urban communities and our rural communities. Quality of care received. We, as a public health community, often with the responsibility of the regulatory aspects of what we do, have to work collaboratively with our professional societies to ensure that we improve the quality of care that's delivered within the healthcare settings, working with individuals so they understand and become more health literate so they can be part of the decision-making process. Making our health system more patient-centered is absolutely essential, a part of that. And then, as I mentioned, there's lots of structural things, making sure that we put transportation systems in place, that we make sure we deal with food deserts, making sure we deal with educational deserts. What we learned during COVID, IT deserts, where people, simply couldn't get online and therefore had differential outcomes because they could not get tested, they could not get screened. We learned a lot during COVID about disparities. As you know, we had terrible, terrible health disparities early on in the outbreak, some of which we were able to close up because of some concerted effort. Some we were not. But it's important that we look back at that experience. And I think some of the things we learned from COVID was that we need to deploy our efforts in underserved communities on day one of any time we have any of these kinds of crises so that we can deal with the issue of people who are disproportionately impacted by chronic diseases, people who are disproportionately impacted by lack of access to care, people who don't have the financial means to be cared for early on. Put those systems in place early on so that we can address those disparities and hopefully mitigate them before they occur.
Director Vohra, any particular initiatives or innovations here in Illinois that you'd like to highlight to address some of these issues we're discussing?
I think part of what we have begun actively focusing on, especially over the last 2 years, is thinking about this around public health infrastructure and the necessary focus that needs to be there to invest in health equity, but by doing that, invest in the communities all across Illinois. Because my belief, and I think at the core of this, is in order to address health disparities, we have to have community-led, community-built solutions and structures, ones that understand the culture, understand the specific social and structural issues, and have the built-in trust necessary to make those changes. For me, that starts so much around how important communication is, communication that's necessary in terms of targeting the right kind of messages, building that sustained opportunity and trust with trusted messengers. Second, it means that we have to think about the workforce and the workforce challenges. My great belief is that there's no wrong door into public health. We need all kinds of different unique expertise and leaders in order to make the impact that is necessary. And finally, how we take structures such as the State Health Improvement Plan that says right at the beginning that in order to improve health and to address health disparities, it can't only be a health related solution only by the health sector itself. As Dr. Benjamin said, it needs to be health in all policies, thinking about things like transportation, economic incentives, human services, and so many more, education, et cetera, to make that happen. I think a prime example of this is the governor's birth equity initiative that he has proposed in the FY25 Illinois budget, really to address the challenges around maternal health disparities, thinking about a complex coordinated solution that brings multiple agencies together, provides resources that allow that team approach to improving health and addressing health disparities.
Been a lot of effort put into this issue, a lot of progress being made, but as noted, it is challenging. It is not an easy process. I'd like each of you to weigh in on what do you see as the biggest hurdles to achieving true equity in public health. Dr. Benjamin, if we could begin with you, what do you see as the main hurdles we still have to overcome?
I think there are a couple of things. Number one, not aligning all of our efforts across all sectors to try to do this, as Director Vohra said. I think the second thing is this false belief that if one group benefits, other groups have to have a problem and don't benefit. This is not a zero-sum game. When you work to achieve equity and then ultimately achieve optimal health for all, and I want to explain that because you could be equitable and have poor health. So what you want people to do is have optimal health as well as equity as part of that process. And if you do that, everybody gets better by making sure that systems get everybody in and nobody out, that the quality of care gets improved for everybody, that we improve everybody's individual engagement in the health system. And as we fix these societal structures that discriminate to people indiscriminately, in some cases, and some times focus on certain groups, if we can fix that so that everybody benefits from our society, then everybody benefits. And by the way, there is a huge economic loss in the billions and billions of dollars because of these disparities. So it saves money and it improves health.
Director Vohra, that's another important point here, that these are issues that don't just impact those who have historically been subjected to these disparities, but they do impact the broader society at large. Can you speak to that?
Part of, I think, the shared understanding that needs to continue to happen is that we are better as a state, as a country, when all of us have the optimal health to be able to live the quality and standard of life that we all expect, right? How do we create those brighter futures for all? And sometimes that is difficult, right? It's difficult to communicate. To Dr. Benjamin's point, sometimes it does cause fractures in our discussion and in many ways, sometimes our actions. But the ability to coalesce here, and one of, I think, the great strengths of public health in my travels across the state and across the country, at its core, we all want to protect our own health, the health of our loved ones, and the health of our community. Makes our community stronger, allows us to enjoy the parts of life that we want to enjoy, and ultimately allows us to make the differences that we want to make in this state and in this country and in this world. And for me, as we continue to do this work in Illinois, it's an important charge for us to come together around this noble goal and really say that we are all unified around this vision for a healthier state, a healthier country, and a healthier world. And working together to accomplish that goal is a true testament of the power and ability that public health can bring.
Dr. Benjamin, I'd like to give you the last word today on this issue, why this is so important, and where do we go from here?
You know, we have been trying to achieve health equity for over 400 years in this country since the first slaves came to this land. We've been trying to achieve health equity as we tragically decimated the native peoples of this land. If not now, when? And so health equity is very important that we achieve. We have the means, we have the knowledge. We just have to make sure we get the political will, roll up our sleeves and get it done.
Dr. Georges Benjamin, the Executive Director of the American Public Health Association, along with Dr. Sameer Vohra, the Director of the Illinois Department of Public Health. Thank you both for joining us for this important discussion. Please join us next time for another edition of This is Public Health from the Illinois Department of Public Health.